Dr. Patrick needs no introduction. He's been on here before. Last year you came on, and actually our discussion last year was on AI and animal reproduction. So it's so funny because we're going kind of like the opposite end of the spectrum for today's discussion, because we ended up having to do a post-mortem. So thank you, Dr. Patrick, for coming. For those of you that are new with us, Dr. Patrick is one of the vets with Nutrimix, and he's very experienced, very versed, and he is ready for anything called a postmortem at the drop of a hat. You just say postmortem, and he's like there, no questions asked. So Dr. Patrick came to see us, I guess it was about almost 2 weeks ago now. Gosh, time flies. Week and a half?
Yeah, maybe.
Week and a half, 2 weeks ago. And actually, he was coming by, actually not even for the postmortem. He was coming by to drop off some stuff. And it just so happened that one of our baby goats died. And when we were putting the flyer together, we said, what happened to my kid? And we're like, no, we need to change that to baby goat, just in case somebody thinks we're killing children around here. We don't want that. So we said baby goat. Right? So just for you guys, just to get a little bit of background on what's going on with this kid and her mother. So the mother actually has mastitis, which we're going to talk about that later in the presentation. But what we've found with this mother is kind of like it was hit or miss. Some days everything is, well, when she has kids, they're nice kids, the ones that do well, and then the others have had challenges on and off. So, you kind of work with them to decide, do you want to keep the mother or not? So I think we might be on the last leg with this mother, because she did give us 2 beautiful kids, girl kids, in this go around, but then the one died. And so what happened was she had mastitis. So one of the teat was working, however you say that, okay? And so the one kid was sucking the one teat, and then the other kid, she just kept pushing that one away. So a couple of days we kind of noticed what was going on. We're like, okay, let's separate her. But you guys know, if you try to separate a kid after they start sucking, at first they kind of fight you and they don't want the bottle. But we gave her that first bottle. She ate well. We're like, okay, great. We're good. We can do this. And then the next day, it's just like every day after then, she just progressively got worse. And so we were, drenching her with milk, because we're like, maybe I was thinking she had a broken heart, because she was crying. I'm like, okay, we just broke her heart because we just split her up from her family. And now she feels like an orphan and she won't eat because she just has a broken heart. So we were trying everything with her, and we tried and we tried and we tried, and then she died. And the day she died was actually the day that Dr. Patrick happened to come and visit us. So Dr. Patrick, take it from there and tell us what your observations were with that postmortem.
Okay, so I must say that based on where I'm coming from, and I've been in Europe for quite some time, and the general consensus is, or the rule of thumb is, everything that is dead must have a postmortem done, because you really need to know what's going on. And it's important to know what's going on because it could affect other animals on your farm. It could affect your neighbors. It could be something that is reportable that you need to report to authorities, government vets, and all these things can affect quite a number of things. It could have a chain reaction. It could affect international trade. If we find certain things, it could affect if we can actually export anything out of Jamaica to other countries. So it can have very vast implications. And so, just like human beings, every person who dies, a postmortem has to be done to figure out why that person dies. It's the very same thing with animals. You really need to do a postmortem to know what happened, and and to figure out if it was something very innocuous or something that could cause great damage to your farm. So that animal died. It was quite fresh, meaning that there was there were no changes in the body, so we could really see basically what was going on before the animal died. Mm-hmm. It was a small kid, and initially I look at the outside, it looked normal. The animal was a little bit thin, wasn't maybe getting enough milk, because, as I said, one teeth was working, the other one was not working very well. And as I go on in this chat, we will talk about some of the things that causes mastitis, and some of the organisms that can cause mastitis can also cause the condition that we're seeing in your animals. So we will also talk about that. So doing a postmortem, it's just like doing your regular exam when you look at an animal clinical exam. You basically look at everything. You just don't want to open the animal, see one little thing that is of interest, and then you focus on that very much. So you look at everything. Even if you see what happens, you still continue and look, because whatever you're seeing could be secondary, and you really need to find the primary cause of death of this animal. So we look at the abdomen, because generally when I open animals, I open the abdomen first. Reason being, an animal could die from what we call a pneumothorax, meaning that the chest would have been damaged, air would have gotten inside there, and the animal could have suffocated and died. The only way you can find out that is if you open the abdomen, and then you could make a little poke in the diaphragm, and if the diaphragm comes back to you, then it means that the animal was fine. If it does not move or goes the other way, it means that there would have been hair inside there. It wouldn't have been it wouldn't have been, it would have been compromised in a case. So generally, that's what I do to find out whether animals have that problem or not. Because the animal could get stuck by a piece of nail or a piece of wire or something, and the animal could have suffocated easily. You wouldn't have known what would have happened right there. And so I looked at everything. Everything seemed normal until we got to the chest. There was quite a lot of fluid inside there, and a little bit of fluid is okay for the organs to move about. But there was quite a lot of fluid inside there. The fluid looked really awful. It was red. It has yellow tinge. Something looks like pus. And when you looked at the heart for a small kid, the heart was grossly enlarged. And once you see a very big heart, right away you know that it's a red flag. Something must be going on. But then you really don't stop there. You have to look and see exactly what's happening. I removed the pericardium. That's the thin little membrane around the heart. And right away there was lots of fluid running out of that, and that fluid did not seem clear. Now, in a normal animal, when you open the pericardium, you will find a little bit of fluid. It looks like water, but it's a little bit thicker than water, because the heart is moving. It's like grease, what you have in your engine, because the heart is moving, it's beating very fast, and it needs all that lubrication. But what we found in that animal, it was very thick. We find pus inside there. It was fibrin. And when you see fibrin inside there, it means that the vessels around the heart became leaky. It was leaking fluid from the vessels, and that's also a very huge red flag. And we saw lots of nasty stuff, things that the regular man would not want to see. And when you see a chest cavity looking like that, it means that that animal was really going through a rough time. And there are quite a number of things that could have caused that, things that we'll talk about, and I'll list a few of them. And maybe we should just start right now. Number one organism that came to mind, I had a look at some research and see how very common this in goats. It's pretty common, and it's an organism that we call Mycoplasma. Now, Mycoplasma is a little bit different from bacteria. Whereas bacteria will have this, what we call a peptidoglycan or a cell wall around it. The Mycoplasma.
Dr. Patrick,
let's narrow it down. Let's narrow it down. So the bacteria will have something sort of a cell wall around it.
Okay.
The Mycoplasma will not have that. So it is much more efficient in entering cells and entering all sorts of body tissues and organs, including the brain, and cause disease. Now, there are five basic problems that you'll find happening in goats in particular with this particular disease. The first one, it causes respiratory problem, and that's what we saw in your kid.
Okay.
She had a great respiratory insult. The heart was damaged. The lungs tend to look like, when you see the lungs starting to look like liver, then you know that you're having quite a bit of issues. And we see that in pigs quite a lot too.
Okay, can I ask a question though?
Yes.
So the respiratory problem,
yes.
How would we have seen that?
Well, the first thing that you'd see, and with animals, it's a bit more difficult than with human beings or even with your pets. With goats and cows and all those animals, they're farm animals. And when they're sick, what they do is the body tries as best as possible to actually, fix itself. The animal will try as much as possible, if they can, to actually move around, to seem okay. When they can't anymore, they start to lose body condition. They start to hide away a little bit. They start to, they might suckle less. They might go to the feed pan less, drink less water, and then they start to get very thin overall. If you don't actually go and do a physical exam, check that animal, listen to the chest wall, you will not know what's going on. Or unless you go and you take a blood sample and run it and look at the blood profile and see what's going on inside there, you will not know what's going on. And that's why it's more efficient when you talk about cats and dogs, because somebody will see their dog behaving a little bit weird, and then they'll take it to the vet, and you find that out. You do a complete physical exam, you take blood, you do x-rays, and you find that out. It's much different with a goat because it's on a farm situation. Most of what we can do is actually look at the animal, check the temperature, see that there's a temperature. You may listen to the chest wall. A trained person will hear very different heart sounds. You know that there's a problem. In your kid, if that was done right away within a second, the vet would have known that there's a problem. This animal is having a serious problem and we need to actually treat. Or if it gets to a certain stage where you can't treat anymore, you just have to cull the animal. Because with your kid, if we had found that kid maybe 2 days prior, we wouldn't be able to save it anyway. So just so you know. Yeah.
So we just really need to be aware and observe your animals. If they start lagging behind, like you said, not eating as much, staying away from everybody, that's some of the first indicators that us on the small level as a farmer. So there's things we need to look for. Okay.
So and the one thing that I need to say right here before I move on is that farmers need to stop treating their animals as their pets. I understand that you all love your animals, and the first thing you want to do in the morning is just run out there and hug them and play with them and run around them. That is the wrong approach. The correct approach in your case, for example, like where you live, when you exit that building, the first thing you do is you stand outside the metal gate and you look inside and you observe all your animals. Say, for example, you have 30 animals. You observe all 30 animals, what they're doing. If you know them very well and very intimately, you know that this one likes to run around, this one likes to run up to the fence. And if you notice that that one in particular is lagging behind, staying alone somewhere, that is what you look at. So that's what you do the first thing every morning. You observe your animals, look at what they're doing, and that's how you pick up that something is wrong. And then you can actually check out that animal, because that's one of the easiest ways of finding something. It's best to call the vet in and there's no problem than to not pick it up and then you end up losing the animal.
Very true.
So
very true. Observation is key.
Yes. So respiratory problem, that's number one for Mycoplasma. The second one is arthritis. It causes arthritis predominantly in kids. You have them having the joints being swollen. You see that a lot in kids and goats where they have swollen joints. The next one is mastitis. And you mentioned that the mother has mastitis. So the Mycoplasma can also, cause mastitis in the mother. The kids could get it. The kids could have either the arthritis only, they could have the arthritis and the respiratory problems, they could have conjunctivitis, septicemia. That's a conjunctivitis and septicemia, those are the other two. Conjunctivitis, we know what that is. It's inflammation of the lining around the eyes. And septicemia is basically blood poisoning, where the bacteria, the organism is in circulation in the body. The animal becomes very weak, debilitated, and eventually just waste away and die. And generally with this one, for small kids, their immune system is not as strong. They tend to die very quickly with this particular microorganism.
Wow. Okay. Wow. That was a lot. I hope you guys, I forgot to tell you guys, you need to take notes because Dr. Thatcher is going to throw out a lot of stuff. Okay. So, let's talk a little bit about mastitis then. So, is it hereditary? Like, can it go down through the line? Because if she's always throwing female kids, do we have to worry about those kids eventually?
So mastitis is not hereditary. It doesn't pass from down the line. It's an infection. It's inflammation of the mammary gland, and with good husbandry, with good management, it's something that you can prevent. So it's not something that you have to worry about. If the mom has mastitis, the kid does not have to come and have mastitis. So it's a management tool, and these things you need to put into practice to ensure that you prevent that. And some of these things that you do, you ensure that if the kids are not suckling, you have to milk out that animal. Sanitation has to be good at all times. If people are milking those animals, you want to ensure that hands are clean or whatever. If they're wearing gloves, hands should be clean at all times. And if you look at milking parlors, you know, you run a goat farm, if you look at cow farms, what they do is that they clean the teeth of the mammary gland thoroughly before, and as soon as they finish milking, they will apply iodine solution, because then the teeth cannula is now left open, and then you don't want bacteria to actually enter through that, what we call ascending infection, go up inside there and cause infection, and then you have full-blown mastitis. And you know, with some of these, the treatment for some of these are varied. You know, some people tend to put mastitis treatment up the teeth, not very effective. Because with some of these, you're talking about systemic problems where animals become very sick, lying down, there's lots of bacteria circulating, lots of toxins circulating in the body. So you really need to do systemic treatment, and that's the best thing when you have mastitis. Early treatment, systemic treatment, that's the best thing in terms of getting the animal back to full speed.
Yeah, we tried to do the injecting in the teeth, and it was just hard to do, and it wasn't going anywhere. It was just kind of spewing everywhere. I'm like, this is not working.
Those things are basically, in my opinion, they are for prophylaxis. When you're weaning animals, when you're drying off your animals, and you're not going to milk them again, you want to actually put some antibiotic up the teeth to ensure that you don't have any ascending infection taking place right there. So, but for treatment, systemic treatment is the best way to actually deal with these problems.
Okay, so you mentioned sanitation. So you mentioned it in light of milking. Of course, the milking parlor should be clean, and because you don't want an infection to go back. I forgot the fancy word to use, to go back up in the teeth to infect the mother. But can sanitation also affect the health of your herd?
Yes, sanitation is key. If your floor is always messy, dirty, if we're talking about kids right now, if you have them on the ground, if it's cold, if it's wet, what basically you're doing is you're helping the animal to, you're reducing the animal's own immune system, and once the immune system is gone down, the animal is open to all sorts of things, and they don't really need to have to get bacteria from the outside. We have bacteria living in our throat, in our intestines, and all over the place. And once your immune system is gone, the immune system is like the policeman of the city. And once you take them away, all of those bacteria, they have leeway to actually invade and cause problems. And that's the same thing you have with problems like Clostridia, while you vaccinate, because once the immune system is gone down, then the Clostridia, they can replicate and multiply and produce toxin, and the animal die within a few hours. And so it is key that sanitation be, the number one, thing that you put in your farm. Ensure that the place is always clean, and not just sanitation. Biosecurity is also important, because you can't really have people running from God knows where and straight into your barn. And we talked about that the last time we were there. It is a major concern, and we've seen people even in Europe who did not practice good biosecurity. Let's not people, veterinarian who did not practice good biosecurity, move from one farm to the other. There was one particular vet in Belgium who actually got delisted. So he lost his license because he was moving from farm to farm. And when they tracked that disease issue that they were having, they tracked it straight back to him, and he actually lost his license. So something that looks simple as that, but it's not really very simple.
So explain to us, what is biosecurity, and what are some practices that we need to put in place in order to practice biosecurity?
So, if you break up the word bio, we're talking about biological organisms, human beings, other animals, and security. We all know what that is. So you're trying to secure your place from that. And, the number one person that you really need to look at is your vet. So don't think it's the other farmer, the other person. Your vet will go everywhere. They'll see animals of all sorts. They'll be on every farm. So the vet is the number one person, me. You need to ensure that when your vet enters that farm, that you actually know where they're coming from that particular day. If you're the first farmer they're actually seeing, they can't just walk on with their boots like that. You ensure that they cover it, at least cover their boots. If they can't do that, then you should have a foot bath at the front of your facility to ensure that they can actually walk through to disinfect. But preferably wear a plastic boot, and they can also walk in the plastic boot through that foot bath. And that's it. Hands should be washed. You don't want them to leave your farm holding your animals and then walk down to somebody else's farm and holding those same animals. For example, I go on a farm, I didn't use gloves, I was, you know, dealing with abscess and whatever. And then I came to your farm and I started to deal with your goats. All of that bacteria on my hands, and now they're at your farm, so you have to be really careful. And you shouldn't be ashamed to ask your vet, where are you coming from? Am I the first person you're seeing today? It's all okay. If your vet fails to answer those questions or don't want to answer those questions, you have the right to ask that person to leave, or you can't enter my farm today. But you find that people don't do that. What people do is they're so happy to see the vet that they forget about these things and biosecurity. And as I said, the number one person that you need to pay attention to is your vet.
Okay. Now, there are other organizations that come to visit from time to time, any kind of farm, you know, anybody that's responsible for taking care of farmers and helping farmers. So like even like your RADA representative, anybody like that is going from farm to farm to farm, they definitely need to practice it. So we've done it. I mean, when they come and we're like, where's your stuff? And they're like, we don't have anything. We're like, sorry, you can stay outside and look, but can't go in. So it's like you said, it's our right as farmers because we have to protect our herd. Nobody else is going to protect it.
No,
right?
That's true. That's true. And
So
you know, we and you know what we say to our guys is that we're the one preaching biosecurity, so we have to practice it. We have to be the at the forefront. So you know, we will walk into your farm, and you know, we wear the plastic boots. We put on our gloves, and you know, we you know, if I'm on your goat farm, you know, I put on my coverall. I'll take it off when I'm going to another farm. And when you know, whenever you take off those plastic boots and your gloves, don't put them in the back of your van. Don't you know, leave them on the farm. If there's no garbage bin, drop them right there and leave them, because taking stuff off the farm and taking it somewhere else, it's just like, you know, it's not biosecurity anymore.
So you said the foot solution or the foot bath. What can we use to create a foot bath?
Well, the cheapest thing you could put in a foot bath, you know, you could have a little concrete area and fill that with water. The cheapest thing you could put inside there is bleach. And depending on the traffic on a daily basis, if you're walking through that on a regular basis, then you'll need to change that quite a few times a day. If you're not going through there very often, then you could have one mixture for the whole day. And you know, if it's just you just walking through a few times a day, that's fine. But if you have traffic, let's say you have a group of people from RADA who came in and they'll all walk through that, then you might need to change that after, you know, they've gone, put a new solution inside there. Then you have J's. J's is also okay. And then you have all these expensive other stuff that, like Viracid, for example, you might not need to buy. Bleach should be good enough. Bleach and J's, those are two cheap solutions that you can buy and use, and that should be good enough.
What's the percentage of water to bleach or water to J's?
I would not be able to tell you that off the top of my head. I'd recommend that you research that, and usually the labels will tell you what you can use.
Okay, awesome. All right, so did we get done with mastitis? Did we talk about everything with mastitis?
We talked about mastitis, and there are different types of mastitis. You know, there are those that are caused by the simple bacteria, you know, Streptococcus, the staph. There's E. coli, you know, there's the one that we're talking about right now, Mycoplasma. Mycoplasma mastitis is very difficult to handle, very difficult to treat. If it started, you know, just now, it's very acute, meaning that it started only a few days, and you can find it, identify it, you'd be able to treat it effectively. If it has been going on for a long time, it's chronic, chances are you'd not be able to get rid of that with treatment. You might have to cull the animal. And you know, get the animal out and not have them, you know, passing it on to other animals. And generally, once you see an animal in your herd with mastitis, the first thing that I'd recommend that you do is isolate that animal, because you don't know what it is. It's best to isolate. When you find out that it's not something that can cause problems to your other animals, then you can reintegrate them. But isolating animals, you have a sick bay, which is very good. You could get your animals over there and keep them there for a while until they're okay. You can reintegrate them into the general herd.
Okay. Would you also recommend, like we said, she had 2 kids and only one teat worked because the other one was messed up because of mastitis. Would you recommend like pulling one of the kids from the beginning? Because we waited a little bit because we thought it would be okay.
What I'd recommend is, what you could do is actually bottle feed. You could milk out that one teat, and you could bottle feed both of them instead of taking one and put somewhere else. So you could also do that. And since we're on the whole notion of the whole topic of bottle feeding, one of the problems that you can find with bottle feeding is that too can lead to pneumonia. And it doesn't have to be just the mycoplasma or the other bacteria. Bottle feeding can lead to pneumonia. If the hole in the teat that you create is too big, then you can have a problem, because what they'll do is they try to drink very fast and drink a lot, and all that milk rushing down the esophagus very quickly, you're going to have what we call aspiration pneumonia, because a little bit of it might enter the trachea, down the lungs. And I've opened hundreds of animals all over the world. And, sometimes, I remember maybe last year I opened like 3 calves, and once you cut open the lungs, the lungs look like mammary gland, because it was just fresh milk running all over the place. Because they drank aspiration, and there's just where oxygen should be flowing, you have milk. So you have to pay attention to the teeth. If you cut it too big, animals are drinking very fast. They're going to get aspiration pneumonia, and that could end up killing your animals just by having too much of a big hole in the teeth.
In the bottle that
yes,
you're feeding them with.
Yes, the nipple.
The nipple.
If you notice the mother's breast, you have to apply pressure for it to actually come out. It's not very big. So what you need to do when you're feeding them, bottle feeding them, you need to mimic nature. You can't give them a very big hole because they feed very fast. They're not supposed to do that. They're supposed, and also when they drink milk, it's the milk doesn't go into the rumen. When they eat food, it falls into the rumen. When they're drinking milk, I think there are 3 things that they need to do when you bottle feed for the milk to actually enter the right stomach. So the first thing is that you need to mimic what they do when they're sucking. So they usually go under, they turn the head up and they suck. So that's what you need to do with the bottle, to let them turn the head up and you feed them down like that. You don't let them drink from a bucket or drink from something like I see a lot of people doing with calves. The next thing has to do with temperature. The temperature of that milk that you're feeding. If you just get it from the mother and it's warm body temperature, you can feed it to them right away. If you collect it and you put it in your fridge, you can't feed it cold, because for the groove to open, and the groove is not always open. If it's not open, the milk is going to go in the esophagus, and it's going to cause a whole other problem. So the temperature of that milk needs to be at least body temperature. So if you have it in your fridge, you'll need to warm it, and you cannot put it in your microwave. And I just need to say that, because if you put it in the microwave, all you're doing is the microwave is going to denature the proteins, and basically you're feeding them just water and not milk anymore.
Okay. And you said there's a third thing. So mimic.
So you need to mimic that. Yes. Body temperature needs to be very constant. So yeah, I guess it's 2 things and not 3 things. So but temperature and mimic what the mother does. That is key when you're doing that.
I'd say the third one is make sure the nipple is not too big, like the hole.
Well, you could. That is a part of mimicking nature. So yeah, it goes in the first one.
I like to make everything clear and simple, because like you said, a lot of people are in a hurry, so they want to put a big hole so that I can drink this. Hurry up, I gotta go, but they can't do that.
You might get away with it, but you stand a very high chance of causing aspiration pneumonia, and you could kill animals just by doing that.
Okay, I had no idea, and everybody's just, let's bottle feed. They're so cute, and don't realize the danger you could put your kids in. So you still have to know what you're doing. Okay. Yeah. Wow, that's awesome. That's a lot of great information right there. Oh my gosh. Okay. So let's see. It's been raining a lot, more so in St. Mary in these areas. And you cover, what parishes do you cover again?
All of those parishes, anywhere from Clarendon right back to St. Mary, Portland, St. Anne, all those. Okay,
so half the country basically. So for those of us that have had a lot of rain, we've had challenges. I mean, for us, I know we've had rain since the end of October, and the reason why I know is because my birthday month was in November, and I wanted to have an activity every weekend, and my first one was washed out, and I'm like, okay, so, and we just had rain up to, like I said, 2 days ago. So rain, and when I say rain, I mean pouring rain. So we've had our fair share of challenges, and I'm sure you've come across a whole bunch of challenges at other farms. What are some of the challenges other farmers have had with all this rain?
So the first thing is there's difficulty getting feed, because goats are ruminants, and ruminants eat grass. And we've said that multiple times, or every time we open our mouth to talk about nutrition, is grass, grass, grass. They need to eat grass, and if you don't have that, then you run into problems. And with all that rain, you don't have it. You don't have access to it. The animals are not going outside. And people always say goats don't like water, because goats, they will drink water, but they hate to be out in the rain. If you notice, you'll see goats in anywhere around the place. They're always on rocks, and they like to stand on rocks and stuff because they hate it when it's muddy and wet, and they tend to have foot problems. And so that's the first thing with having a lot of rain. There's very limited access to feed. The next thing is that you started having lots of foot problems, and then once you lose your feet, then you lose your animals. So those are the two main things. The other thing is that if the place is consistently wet and it's cold, same thing for us. People start having respiratory problems, puffing and puffing. You start having your younger animals or those who are weaker, they start having all sorts of problems because your immune system starts to fall down, and then you start having lots of other viral infections, bacterial infections, and from out of nowhere you find that your animals started having all these major issues, and then you might think you're having a major influx of disease from elsewhere, but it's simply because the animal's immune system become compromised, and then they're opened up to any and everything. So these are the main things that you find in the rainy season. When you look at your goats and sheep, you generally see a lot of runny nose, and that's as a direct result of diminished immune system, and animals started having bacterial infections or just mild viral infections.
Okay, so how do we help prevent hoof rot? And well, first of all, what is hoof rot? And then how do we help prevent it and take care of your animals?
So hoof rot is basically, once the time is wet, that's when you basically get lots of your hoof rot problems. Some of these problems are caused by bacteria. Some of them are sometimes you see feet that look like it's hoof rot, but it's actually not. We're seeing lots of fungal infections. We saw some the other day in Portland that are affected by what we think is another type of organism that we call dermatophillosis. We saw some recently also that looks like they look like hoof rot, but they're actually caused by the immune system attacking itself, attacking the body and causing all of that problem. So we see that with in human beings. I'm pretty sure you've heard about lupus.
Yes.
Yes. So we have it's a similar condition to lupus, where the body will attack itself, and then you see all sorts of problems around the foot and on the skin and all over the body. And these things, they can mimic hoof rot. They look like that. Animals will start to limp on the foot because it becomes very painful. So all of those things. But with hoof rot, basically what you have is you have invasion of bacteria around that area. Apart from maybe the brain, the hoof is one of the areas where you have most of those capillaries, small capillaries.
Okay.
And once you have bacterial invasion taking place down there, for example, in horses, you start finding that they're limping, and they start having lots of problems. So, and once you lose your feet, then the animal is gone.
Wow.
And with hooved animals, goats, sheep, pigs, and horses and cows, they are the main ones. Once they are in very cold, wet conditions, they will tend to have that problem, and it's very difficult to actually control unless you have a slotted floor. It's one of the best things to actually prevent that. If your animals are on the ground and the ground is always wet, chances are you are going to run into that problem, especially if you live in places like Portland, St. Mary, where there's a lot of rain. It was only yesterday, I think, Portland had a flood. I saw that on the news.
Really?
And so you will find that those animals might suffer a lot from that. Animals in Portland, they will suffer more from Clostridial infections and blackleg than anywhere else in the country because of the rainy season that they have. It's much different from the rest of the country. So with that type of problem with the feet, in those areas, you'll find it more than anywhere else.
Okay, so we need to keep them elevated, basically up out of the
keeping them elevated, keeping them out of the water, out of the mud, and check the feet on a day. You don't have to check it on a daily basis, but routinely, if you see an animal behaving weird, not limping, it's a good idea to check right there, because the earlier you get it, the better, the faster you can fix it. Okay. Have your vet check your animals on a regular basis. They don't have to be sick. But the correct thing to do is to have them do routine checks on your animals. You can schedule it for maybe every 2 months, every quarter, to ensure that, and have somebody else look at your animals, because you're there, you're looking every day, you cannot see everything. And use the analogy. You have some cobweb in your house, and it's there for 10 years, and you've never seen it. But the minute you invite somebody over, there it is. It's right there. So, you know, I do it a lot with, you know, with Dr. Young. She has animals, and every now and again she'll say, Patrick, have a look, because
Yes.
they're your animals. You're always there. You
Always
do not
seen
see
them.
everything. You do not see everything.
That's very true. Did you see my cobweb? Is that what you're talking about?
I did not see your cobweb.
You didn't? I have tons of it though. We have so much we posted about it.
The next time I'll have a look. I'll have a better look the next time.
Please do. So if we find an animal with hoof rot, what do we need to do? Of course, take them out. How do we treat it? What do we need to do to treat it?
So, you know, I'm a different type of vet. I always recommend to farmers that, you know, you don't try to treat your own animals, because you do not always know what the best course of treatment is. Just a minute.
Sure. Guys, I hope you're taking notes. This is lots of information. Even I'm going, oh, wait a minute, I'm writing that one down. So lots of great information.
I'm back with you.
Sure.
I'm back with you.
Go
So
ahead.
the first thing is that you don't try to treat your own animals, because you're not the best person to treat your own animals.
Okay.
It's best to get ideas from the professional. You know, if your vet can't be on the farm, you can always drop a call, you know, explain what you see. This is something that we call telemedicine. It's actually, you know, it works. You know, explain what you see to your vet, tell them, you know, and let them tell you what they think, and then they can recommend what's the best thing to do. Because a lot of times farmers try to treat their own animals, and then they do more harm than good. So that, you know, that's the very first thing. You know, oftentimes they take all sorts of different antibiotics and medication and start to inject it into animals, and we can create our own problems by doing that. So it's best to let somebody who understands what's going on actually, you know, have a look, or you talk to them, send them pictures, videos, because I do that a lot with farmers, and I think it works out a lot better than that. And it's under the law for veterinarians. That's basically how we should practice. Not just by hearing that it's foot rot, we're not sure. You'd call me and say, oh, I have foot rot, and I'll say, okay, give that, and we're not sure it's actually that, because you think it's foot rot. So we have to do a thorough examination. You know, a clean foot is always a good foot. Ensure that the foot is clean. Trim the hooves on a regular basis. And if we're actually dealing with that problem, then we are going to need to have the animals on systemic treatment. And also what we can do is, you know, there's also copper sulfate solution that we use quite a bit for pigs too. We soak the foot in that, and it helps to harden the hoof a little bit. And once we have them on systemic treatment, and we use that, and also topical treatment, then, you know, that should be good enough for your animals. But do not self-treat. You know, we always recommend to use the right drugs at the first time. We don't want to treat with something that did not work, and then we try to use something else, because the problem right there that we're doing is we're giving the microorganisms in the body the chance to become resistant to what we're using first. And if that didn't work and we choose something else, we're creating microorganisms that we might not be able to deal with in the future.
Okay. All right. So, well, speaking about microorganisms, we can kind of segue just a little bit into worming, because that's always an ongoing problem for most people.
Yes.
So,
yes.
And I remember one of the presentations we had last year, or I should say one of the chats we had last year, we did talk about worming. So you can talk about a little bit, are you on the rule of thumb of using 2 types of medicines, and why, and how does that work? And, well, first of all, how do you figure out your goat has worms or your animal has worms, and then how do you treat it?
So when you say 2 types of medication, do you mean use 2 types of medication at the same time?
Yes.
Okay. So in terms of worms, there are a few ways that you can actually check. The first thing that we do is the pharmacia, where you can look at the conjunctiva, and based on the level of the color, the level of redness, whether it's pale, it's white, or it's red, pink, we can say with some amount of certainty that the animal is suffering from a level of anemia. And with a certain level of anemia, we can assume that the animal might have a certain level of worm burden. Anemia does not always say worm, so we need to make that clear. Just by looking at the eyes and the animals are anemic, it does not mean that my animals have worm, because anemia could be because of many other factors. So we can look at your ruminants, level of anemia, we can say with some amount of surety that they might have a worm burden, and then we can go ahead and treat. Now, what do we use, and what sort of medication we use with certain types of worms? If our animals if you look at the feces, the next one you could do is collect fecal samples, take it to the lab. We do fecal flotation. we'll look down the microscope, we see eggs, and based on the morphology of the eggs, we can say, okay, that egg belongs to that worm, that one belongs to that worm, and then we can go ahead and treat like that. If you have tapeworms, they look like rice grain. When you look at the dog poop, you might see something like rice grain on it.
I've seen that,
Those look like, those are tapeworms. Now, goats can have tapeworms. You could inject all the ivermectin in the world; it will not kill it.
Okay.
It will not. So so you really need to know which worm you're suffering from, and not just buy medication, buy ivermectin, buy Benvet, buy that one, and give it to your animals. We need to know the type of worm that we have. Because if you have tapeworm and you're giving ivermectin and you're giving, the doramectin, it's like pouring water on them. It's not going to do any good. It's not going to kill them because that's why you need to know the mechanism of action of these medications, how they work and how they kill worms. So we need to know what you have first, and once you know what you have, then you can treat them. I do not recommend that you use 2 different medications at the same time.
Okay.
Reason being, that's one of the biggest ways of getting resistance. And we know that in the world, not just in Jamaica, we have a big problem with resistance. A lot of people will say, well, I bought ivermectin and it didn't work. Yes, it did not work because there is a problem with resistance, and we see that. When I was in the UK, quite a number of my friends were doing studies on similar medications, and they were all resistant, especially in the UK. They couldn't find one that work in certain animals, in cows, for example, and there are many different types. You have some that they say can only be used for pigs, some that use for cows, especially if they have liver fluke, and so it's recommended that you do at least maybe every quarter. Let a vet come in, collect the fecal samples, see the type of worms that you have, and then you know what you have. Then you can know what to use when you treat. And since we're on the topic of treatment and worms, I've seen quite a number of people who just went out and they bought medication, they deworm their animals, and then they start having all sorts of abortions, and that is a major problem. So we need to know when to use the dewormers. We need to know which one to use if your animals are pregnant, and which one to use if your animals are pregnant. So it's quite...
What are your thoughts on only deworming if you need to? Because some people, they do it regularly, whether they need it or not. And then others say they only deworm as needed. What are your thoughts? Which school of thought are you?
So I am coming from the point of view that if you don't have a problem, don't try and fix it. So you only deworm if you need to. And when you look, if you need to go down deeper into all of this, into this stuff, there's something called refugia, and people could look it up. When you're deworming, your aim is not to try and kill all worms, because there's going to be some amount of resistance right there. There is. Whether you believe it or not, there are resistant worms, there are resistant bacteria, they're there. Now, if you're pouring medication in and trying to get rid of all of these worms, you're going to have some amount of resistance. So what you want to do is to leave some of the ones that are not resistant inside there to fight back with the ones that are resistant. Because if you leave only resistant worm inside there, they are going to replicate. You're going to have more and more of them. And then what you're going to find is that you're going to have a whole herd with worms that are resistant to everything. So when you leave at least 1 or 2 of the non-resistant one with the 1 or 2 resistant one, they keep a balance. So the resistant worms can't replicate to the point where your whole farm is covered by the resistant ones. And so the aim is not to completely get rid of everything, is to leave a few right there. And as I said, if you don't have a problem, don't try and fix it. If it's not broken,
don't fix it.
No.
Okay. All right. So you're saying, because a lot of people they'll check their goats, the eyes don't look like they should. Okay, I have worm. They should be calling the vet to come and do a fecal sample instead of just, here, give him this, give him.
I would strongly recommend that even if the eyes are looking okay, you do a routine fecal sample and see what's down there. It is good practice. It's best to know what you have, what you're dealing with. And as I said, pulling down the eyes and looking at the membrane does not always mean you have worms, because anemia can be from quite a number of other things. It does not mean worms, and it's best to do a fecal sample. See what you have. That one is telling. If there are worms there, eggs are going to come out. They will come out. If you have worms, you're going to see eggs. You're going to find something inside your fecal. So that's the best way of finding out whether or not you're having problem with worms or not.
Is there a cost for that?
It's minimal cost. It's not going to
Okay.
be a lot. It's minimal
In
cost.
the
All they're
grand
doing
scheme
is,
of things, so the value of your herd, it's worth it.
it's worth it.
Okay.
And all they're doing, they're collecting poop, they're mixing up in a solution. You know, the eggs will float. They collect those. They look at them if they're there, and they decide. You know, they tell you which one that's from, and you know what type of worms you have, and then you can, if you need to treat, you can treat. If you don't have a problem, you don't need to treat.
Okay. All right. Well, since we're going down that road, how about talking about diarrhea a little bit? Okay. So how do we know your goat has diarrhea? What are some of the causes? What could some of the things we can use to treat? I know you're going to say call your vet first, but anyway, go ahead.
So diarrhea is very obvious. The animal is going to be, pooping out his or her intestine. Not all diarrhea is caused by very bad things like bacteria and whatever. A lot of people see diarrhea and they say, "Oh, bacteria and whatever." Coccidiosis, it's one of the main culprits you have in your goat farm, especially your kids. That can cause a lot of diarrhea, and once you have that, you really can't get around treatment. But the only way you can know if you have coccidiosis or it's just a normal bacterial infection, or it's what we call nutritional scores, which I'll talk about in a minute. If you have coccidiosis plague in your farm, treatment is, you have to treat your animal. There's no getting around that. And there's a difference in how you treat with coccidiosis from your bacterial infections. It's very different class of drugs, because you can give all the antibiotics in the world and it will not affect your coccidiosis, in your kids. So we need to figure that out. We need to know that, and the only way you can know that is by collecting samples, looking under your microscope and seeing whether or not you have what we call the oocyst that comes from the coccidiosis. In terms of nutritional scores, this is something that we talk about when it comes down to pigs a lot, but for goats it's also very relevant. If you're trying to feed stuff that the animals cannot digest, they might have scores, they might have diarrhea. If you're changing your nutrition on your animals too fast for different type of formulation, animals could have diarrhea. Because when you're changing anything you're changing in terms of diet, it has to be a very slow transition. So you can't just take away this one and throw that one in. Animals could have diarrhea very quickly, and the only way you can fix that is by allowing them time for the microflora, the microorganisms inside the stomach, to actually die off. And once those die off and new ones to come around, and then your diarrhea will subside. So to prevent that, you have to ensure that you do a very slow transition, anywhere from 5 to 7 days if you're changing feeds, for example. So those are some of the main causes. So sanitation, we go back to that. If your sanitation is poor, your animals could come down with lots of diarrhea, bacterial. So if your place is nasty, obviously you're going to have a challenge with that. So something that people need to pay close attention to. And also, if the place is wet and cold, animals could also have diarrhea.
Okay. So did we talk about the treatment for diarrhea, or what are we going to treat with that for diarrhea, or just let it run its course?
Generally, I will not give out treatments just like that. But for different types of diarrhea, there is different types of treatment. And as I said, for coccidiosis, it's a different type of organism, so it's a different class of drugs that we have to use. If we're dealing with, and generally we'll also give that class of drugs, plus we'll also give antibiotics, because there's always going to be secondary infections. But if you look at the feeds that, Nutrimix feed, for example, in a goat feed, it will tell you that there are certain medication inside the feed, for example, salinomycin or other medication those are for prophylaxis that prevents the occurrence of coccidiosis. For some feeds, for example, if you look at certain types of pig feeds, there will be low amounts of certain antibiotics to prevent certain occurrence of ileitis or gastrointestinal problems. So you will find that. But when it comes on to treating diarrhea, the first thing that we need to ensure is that diarrhea is pooping out a lot of water. All of that water needs to go back in. So you need to, the first thing to, and when animals have diarrhea, it's not the bacteria that will kill them or whatever. You know what kills them? It's dehydration. And so you have to rehydrate the animal, and water alone cannot do it. So you need to, because they are losing water, a lot of it, and they're losing quite a bit of electrolytes. So you need to replace the water and electrolytes. So things like Pedialyte, some of those vitamins or electrolytes in water, and drenching the animals with that at least 2, 3, 4 times a day as much as possible. The more you put in, the better. But we don't want to overhydrate because you can run into other problems too, because there is also a condition that is called water poisoning, and you can find that in animals. There's salt poisoning and there's water poisoning. So you really don't want to overhydrate and do it too quickly. So you need to measure it. But the first rule of thumb is if you're having diarrhea, if water is coming out at the back end, water needs to be going in at the front end.
Okay. Are there any kids too young that how am I saying this? Can a kid be too young to give them like Pedialyte, or when do you just kind of leave it and watch it, or when do you?
If they're a day old and they're having diarrhea, treatment is necessary.
Okay. Yes. Okay. All right. That was a good question that I asked in a bad way, but I'm glad you figured out what I was asking.
There are no bad questions in my opinion.
All right. Very good. So, wow, we covered a lot today. So a lot of people are having health issues with the weather, and it's cooler. And I know a lot of people think, oh, it's Jamaica, it stays warm all the time. No, it gets cool and wet here. So it does give rise for challenges with our animals. So,
and can I say that February is the coldest month of the year? And a lot of people don't know that, but February is actually coldest month. It is the coldest month. And if we're having rains and it's already cold, cold and wet is 2 big no-nos. So already we know that we need to tighten our management protocols, especially in December, January, and February. The chicken people will tell you that those are the 3 worst months in the year, and it's also very bad for all other animals.
Wow.
If you have them on slotted floor and you have them on good housing like you have, then that's a very big plus. But if you have them on the ground and they're somewhere out there without proper housing, then you could run into a lot of problems.
Okay. We should probably try to, because wind blows a lot, like the wind and the rain blows. So we should probably try to block some of that wind coming in, because
yes, because that will help to chill the animals a lot more. And once they're too cold, that will undoubtedly damage their immune system. And once their immune system is a little bit lowered, they're going to have all sorts of problems.
Okay. Wow. Lots of stuff here. So I cannot see any questions. So have we gotten any questions that have come through?
Okay, I'm not see. I can only see the first 2 comments. So and this one does not have a question, so I can't say what else. So I guess if the guys are asking, well, how would they get it to you anyway? I don't know.
I know.
I guess you might have to sign into Instagram and let them through the questions right there.
Mr. Producer, are you seeing any questions?
Any questions?
Oh, are there any questions? They can't. There are lots of questions.
Okay.
Can you see them? No, he can't see them.
I can't see them.
He said he can't see them. Okay, so Mr. Producer, tell us the question and I'll repeat it, please.
There's a question about the bumps from vaccination.
Okay.
The bumps from vaccination.
So there's a question about bumps from vaccination. How do you avoid them? Okay. Yes. How do you avoid getting bumps from vaccination?
Okay, so and I'm assuming they're talking about the clostridial vaccines for goats. We had one before, which is the regular Covaxin 8, which was 5 ml that you give to goats on the first occasion. Depending on where you do it, a lot of people do it on the neck. You're gonna get bumps. There's no way. If you do it on the neck, you're gonna get bumps. If you do it right below the front, behind the front leg, that's right at the elbow. So when they walk, it basically rubs that out, and it's always massaging the area. Chances are you might not get bumps, but generally you do. So we've brought in a new vaccine, which is Covaxin 8 Plus.
Okay.
So instead of giving the regular 5 ml, this one is designed for 2 ml. So it's a smaller dose. We give it in the same location, and we almost never get any animals having those bumps. Once you give it, you can massage the area a little bit, and as the animal moves about and the leg is moving, it massages the area, and you generally don't get bumps. But no vaccine should be given on the neck or in front of the elbow. It should all be given in that area. Okay. Once you stick it in the neck, there's going to be a local reaction, and that's where your bumps come from. And they're not abscesses, so we're asking people not to cut open these things. They're just a little reaction under the skin where the vaccine was given.
Okay. Will it go down eventually?
Eventually they do. They do go down eventually, but they stay for a very long time, and it does not look good. And it can be misinterpreted as certain other and these abscesses are caused by something. Generally, they're caused by a condition called caseous lymphadenitis. People will say CL. And if you have that on your farm, it's recommended that you cull those animals because it's almost impossible to get rid of.
Oh, okay.
And if you want to take your animals to Denby and they have that infection, you can't carry them to Denby because if you do your vet check and they have CL, you can't take your animals to Denby. So you really need to ensure that you don't stick them in the neck and then you have that reaction. It looks like abscess. You don't really know what it is, and it does not look good for the aesthetics of the animals either.
Not a good look. Okay. Any more questions, Mr. Producer? Since we can't see them, I don't know why. I'm going to have to figure this out for the next one, how to get the questions, but I don't see them at all.
So what's the proper way to inject your goat? I see a question here from Shamar.
Okay, awesome. Go ahead.
So I'm not sure which injection you're talking about, but let's talk about all of them. So you have 3 different types of injections. You have what we call IV. You give it in the vein, which I do not encourage farmers to do on their own. So the other 2 that you do is the subcutaneous injection under the skin. So you can either, it depends on what you're giving. If you're giving Ivermectin or certain other medication, right? So where I'm pointing on myself, right at the neck, it's like a triangle on the goat. So right in that area, you could just pull the skin and inject the needle under the skin and inject the medication right there. If you're doing injections in the muscles, your needle should be perpendicular to the skin, meaning that it goes right in that same area in that triangle. So all medication should be given in the neck. If you're given the vaccine, which we just talked about, preferably do it behind the front leg in the skin, under the skin.
Okay. All right. Very good. Can you see any other ones? I feel like lost here.
Okay, so you said intravenous, subcutaneous, and intramuscular. But as I said, intravenous, I would recommend that you do not try to do your own intravenous injection because if you damage the jugular vein, then you could run into a lot of problems right there. So we would strongly advise that you do not do it. And if you inject medication, if you go through there, you have the carotid artery close by, you really don't want to damage that or inject medication into that. If you do that, you run the risk of losing your animals because the vein is right there, the carotid artery is right there, and then you have a nerve that supplies the whole internal organs. The vagus nerve running right there. If you damage that, then the animal is over. So I would not recommend farmers to do their own IV injections. You might see somebody doing it and think you can do it yourself. I would not recommend it.
I'm not going to do it. I'm always going to call. What was the other question?
Can a doe survive pregnancy toxemia?
Can a doe survive pregnancy toxemia?
Sure, they can survive pregnancy toxemia. But the first thing that we need to ensure is that we prevent it. And with pregnancy toxemia, this is something that we discuss with a particular farmer. And when we are doing ultrasound, we try to figure out how many kids the animal have. Because if you have a goat with 4 fetuses, as opposed to one with just 1, you need to feed them very differently. You can't feed them the same way. Because when they get to like the last few months, for example, when those kids are growing and they need more glucose, they need more nutrients, they're going to pull more nutrients from the mother if she has like 3 or 4, as opposed to the one with just 1 kid. And so that particular goat with the 4 kids is going to be the one who's going to be falling into the pregnancy toxemia. So their body condition needs to be very good going into pregnancy, throughout pregnancy, and you need to feed them more if they have more kids. And that's why we'd recommend that you get the ultrasound done early, figure out if they have more than 1 or 2 or 3, which you can see on certain occasions. So that's what we're trying to do now for most of our farmers. If you have 3 kids, we tell you these goats with more fetuses, they need to be fed more than the one with just a 1.
Makes sense.
And if you get it early enough, it can be treated. We use stuff like propylene glycol, for example. They could get them on glucose. We have saved animals with pregnancy toxemia, but in most cases, if you don't get it early enough, there's not really nothing you can do. And when you open those animals, because generally I'll open everything, the liver is really gone. It's yellow. It's full of fat. because the animal is now trying to pull from the body reserve because they're just not getting enough energy to feed the kids and to feed their own body.
Okay.
So it's very important that we know how many kids the animal is carrying, and you feed them according to the amount of kids they're carrying.
Okay. Very good. Very good. Any?
Baking soda. Does baking soda help with bloat?
Does baking soda help with bloat?
Yes, but since of recent, there's quite a number of people who are asking, can I just feed my goats baking soda routinely to prevent bloat? No, I would not recommend that, because we need normalcy, and inside the stomach, the pH is normal. When you feed them baking soda, it's because it's moving towards acidic and you want to bring it back to neutral. If it's neutral and you're feeding them baking soda, it's going to bring it to alkaline, and you really don't want that, because you're going to kill off your bacteria. And if you kill the bacteria, you kill the animal. So the baking soda, what it does is, when they're having bloat and they're having acidosis, what happens is that there's lots of acid that is being produced inside there by very bad bacteria. So the baking soda is a base, and it will bring the acid right back to neutral, and so that the normal bacteria can work inside the animal. But you should only feed it if it's necessary. You can't just feed it to normal animals to prevent them from getting acidosis.
Okay, very good. Very good point. Too much of anything no good for nothing. So you don't want to put too much baking soda in there. You just only use it as needed. So that makes sense.
So it's like, I'm going to take antibiotics because I don't want to get bacteria. You don't do that.
No. Okay. What's that?
Does DPH help with cold?
Does DPH help with cold?
No. DPH helps if you have allergies. So and that's all going into a different realm. We're talking about bacteriology right now, and that's immunology. If you have something like allergies toward something, allergic to whatever, DPH will help that. If the animal have what you call a cold, which we call a respiratory infection, antibiotics will be necessary in a case like that.
Okay.
DPH will not work.
All right. I know a lot of people use DPH. So now we know, guys, stop using DPH because it's not doing anything.
It does not hurt the animal, but it might not help them.
Okay. Okay. All right. Very good. Any other questions, sir? No? Do you see any other questions on your side, Dr. Patrick?
Nope.
I feel like I'm going down the road without a roadmap because I'm so used to seeing all the comments and reacting with everybody. Okay. Well, we covered a very wide ground. Is that a good way to say it? Yeah, we covered a lot. So a lot of...
It's been a lot.
Yeah, a lot of very good information. And you can't hear this stuff too many times because just about every day somebody has an issue that comes up. And as a group, we try to, network and help each other. So it's good to keep hearing this, especially from the professionals, like when we should call you guys and, what we should do. And you said video chats are good. So we can video chat you on WhatsApp and say, hey, look at this.
Yeah. If the vet is not available, you cannot, if for some reason you want to cut open the animal to see what's there, take pictures, do videos, send them to the vet, let them have a look, because you never know. You might not be able to see something, but we'll be able to pick up something, at least something.
Okay.
If you can do it, if your stomach is strong enough and you can do it, why not? Because quite a number of people, that's what they do. During COVID time, when we couldn't get to certain areas because of restrictions, and there are farmers there, they had to do their own post-mortem, cut open animals, send us pictures, send us videos, and then we communicate like that. So it's called telemedicine. It works.
I don't know if I'm there yet, but if I need to, I'll build up the courage to cut my animal myself, but I will always be calling. Did you have another question? What meds or other items should farmers have on hand?
That's a difficult question. Maybe that's the most difficult one. I think farmers should always have a few things just in case. It does not hurt to have a bottle of maybe a Banamine, antibiotics, but these, I have a certain principle when it comes on to having certain medication on your farm. I would suggest that you have a vet pass through your farm, all your facilities, have a vet pass through, and recommend based on what they're seeing what you should keep in the event. a bottle of anti-inflammatory like Banamine is always good. Bottle of Oxyvet, having that on the farm. Some iron in the case that your animals become anemic and you need to give them, maybe an iron injection. Electrolytes, because you might always need that. Animals might have problems with diarrhea. You might need to do stuff like that. Those are the basic stuff that you need to have. Vitamins, depending on the type of animal, because obviously if you're feeding a balanced diet and minerals, you might not need to feed them vitamins. You definitely need to have things like iodine, alcohol. All of those things becomes necessary. Anything that you need to treat wounds, you're gonna need to have those on your farm at hand, because you might, when you need them, you need to have it right there.
Yeah.
Antibiotics and stuff like that, you might not. It's not a necessity. You don't need it. Sometimes we overuse all these things. Sometimes we use it when we don't need it. I've treated a lot of animals and I didn't give antibiotics because it's just not necessary. And people are begging, can't you give some antibiotics? It's not something that you need. We only give it if it's necessary. Because overusing it is a very big problem for us, not for the animals, for human beings. So I guess those are the main things that we need to have on the farm. Anything else that we need, that should be by consultation with your vet.
Okay. All right. Very good. Very good. All right. Any more? Is that it? Okay. All right. Producer said that's all the questions. So, guys, again, lots of fabulous information from Dr. Patrick. He's Dr. Patrick Craig. I call him Dr. Patrick. So we love that you were able to spend some time with us to share this information, and we'll have you on speed dial. So if we need any help with anything, we can reach out to you guys. So guys, thank you so much. Guys, even though I can't see you, I feel kind of lonely out back here, just me and Dr. Patrick, but I know you guys are there, and we appreciate you coming on with us every week, so faithful. And we will be here next week, same time, same place. Everybody have a phenomenal weekend, guys. Thank you. We'll see you next week. Bye-bye.
Thank you.
Dr.
Bye-bye.
Patrick. Okay.